the Facebook live soon. It will be like 15 seconds or so.
Okay.
So bear with me.
Imran, are you going to get a summary of how many people have signed on, etc., from Imtiaz?
I guess so. We can get that.
Yep, I will be updating it periodically.
What are we calling this platform? Is it Oiko? Is that the name?
It's called Corona.
Yeah, but okay. Okay, fine. Imtiaz, are we?
Yep, we are now live.
Okay. Thank you everyone for joining. I think we are live now. And welcome everyone to today's webinar. This is actually very exciting because this is the first webinar of a new platform that we just launched on the 19th. We launched a website on the 19th. It's a website that that was created by Empower, but the idea is essentially to promote information, initiative, and research on COVID related matters in the context of Bangladesh. And that website was launched on the 19th. And as a part of that overall initiative, which we are calling Coronai Oikko, which basically translates in English, unity in the time of Corona, as a part of that broader initiative, the website is part of it, we also have this, we decided that we're also going to have this webinar platform, which is not, it's an independent platform. So it's not a, so I'm from BIGD, I'm the executive director of BIGD, but right now here, I'm not wearing a BIGD hat at all. I'm an independent social science researcher and one of the founders of Coronai Oikko, the platform and the website and the overall initiative here. So welcome everyone. So today's webinar is the first webinar of Coronai Oikko, and I'm really pleased that we are starting off with a really important area. And I think the broader area is how do we capture the perspectives and what is happening to different marginal groups, which we cannot really capture through regular surveys unless we have very specialized surveys. And at this time, you know, we're all very constrained in terms of the kind of sampling frames we're using to do our work. So any opportunity where we get a chance to look at in a systematic way, we can look at specialized groups. I think it is a really important and extremely powerful to really complete the overall picture of what is happening with respect to, you know, different population groups in terms of the effect of this crisis. So we're going to listen to the presentation, and its title is Concerns, Changes, and Challenges Faced by the Urban Extreme Poor in Dhaka and Chittagong. It's a rapid response survey of COVID-19, and the presenter, the speaker, is Dr. Shoshana Kate Williams. It's my pleasure to introduce her. She is a PhD in anthropology and international development from Adelaide University. Her PhD explored livelihood vulnerability and resilience of homeless women and in the context of Bangladesh. And she has done a lot of work in the area of urban poverty and public health. Worked at James P. Grant School of Public Health and ICDDRB, and she's currently working at Sajida, heading up Sajida Foundation Strategy, Innovation, and Capacity Building. It's a real pleasure to welcome Dr. Shoshana, and we also have two discussants. I'll introduce them later, but right now let's go to Dr. Shoshana for her presentation. Shoshana, over to you.
Right. Thank you so much, Dr. Martin. And also Dr. Mushan and Dr. Amin who are joining us today, and to everyone listening. So tonight is my real privilege to share some insights into the concerns, challenges and changes faced by homeless populations in Dhaka and Chittagong, as well as those living in underdeveloped slums. And it's a population, like Dr. Martin said, is largely under-researched and often neglected within conversations around urban poverty, public health, and international development. So tonight I'm presenting a survey that the Sajida Foundation's Urban Programs team conducted during lockdown. And it was designed to inform the way that our programmatic work will respond and adapt to the challenges the pandemic poses for communities and individuals that we work with. So for context, Sajida Foundation started as a family initiative and has since expanded into a number of development projects over the last 30 years. So we work under a project called Amar Manush, and it's funded by Concern Worldwide and Irish Aid, and Sajid has been implementing this project since 2008 in Dhaka and Chittagong. Initially, the project was designed specifically for the adult homelessness population, as well as children of persons experiencing homelessness. And it's since then expanded over the last 12 years, to also include those who live in squatter and underdeveloped slums, in recognition of the fluidity of the urban poverty space and the precarity faced by this population. So the Amar Manush project has a very specific character, and I'm just going to very briefly share a little overview of the breadth of the services provided, just so that you get a little bit of an appreciation of the context behind the questions that we asked. So pavement dweller centres or drop-in centres are a core feature of the project, and we have 5 in Dhaka and 2 in Chittagong. And these provide a really wide range of services in recognition that homelessness is multifaceted, is complex, and needs both individual as well as systemic level changes in order to address immediate needs, as well as the underlying causes of economic and social poverty and exclusion. So drop-in centres provide locker, washing, resting facilities, some are night shelters. They also provide early childhood development and informal education services, primary health, counselling services, and there's also a variety of outreach services that are provided, including a savings program, WASH, nutrition, community education, birth registration, and a range of other advocacy initiatives at the structural level. And these all have the aim of assisting service users to be better equipped to deal with the challenges that they face when living on the streets, to transition off the streets and improve their health and well-being. So you can see in the table here that as of December 2019, the service had approximately 15,600 service users, active service users. And this represents all individuals, so both adults as well as children who may access the service. You can see in the table that there's more women than men, and this largely reflects the high number of female-headed households that engage with the service. So within this survey particularly, we were interested in changes that were occurring in living location, in food security, income, employment, rates of violence experienced, a bunch of stuff. We also wanted to know about current health status. We asked people what they were worried about at the moment, as well as access to mobile banking services and their migration that they'd already experienced, and as well as their plans post-lockdown. So this was a rapid survey. Data collection occurred from the 19th to the 26th of April. And so for context, this came about 3 weeks after Sajida had provided food distributions to many of these households. We've then been working with ward councillors to put service users on their food distribution lists for additional distributions. And then data collection ended just as Ramadan started. So how do we do it? We had 18 of our staff members conduct a survey via mobile phone. We then ran 3 focus groups after the data collection period with staff to debrief, discuss their observations and their recommendations that they had for us in response to what they heard. Normally, we do the majority of our engagement face-to-face, so we weren't exactly sure how this was going to go, but we had a surprisingly good success rate. We had 72% of attempted calls pick up, and there was no refusals after we obtained consent. We did have a few questions that were skipped over, and that was in line with survey protocols. So, as a service, we have a list of approximately 2,400 numbers and about 1 to 2 numbers per household. And so this allows us to reach most households that we provide services to. So we had the manager of the service provide location-based lists, and staff from that particular location put together lists for themselves based on the convenience quota sample. So we wanted to get a range of responses across people's living locations. So we wanted to get pavement dwellers, squatter dwellers, as well as slum dwellers, a range of ages and of genders. And this was important that people knew who they were calling, because we were asking a number of sensitive questions, and we wanted to make sure that people felt comfortable disclosing and talking about some of these results. And we know that this is a population that is highly reticent to engage with and discuss, really private issues with people that they don't know. And it's also important to note that this survey really captures people who had a recent engagement with the service, so we have an updated number for them, as well as access to a charged mobile phone during this time. Okay. So who engaged? We had a total of 572 responses, which we were very happy with. We had a range of ages, so from young adolescents who engaged in the service all the way through to 50+ years old. We did oversample women. 17.5% were male and 82% female, but we basically just talked to whoever picked up the phone. And it does roughly represent the primary household member who engaged with the service. And we had a wide range of household sizes, all the way through to people who sleep solo, to people who lived with 11+ people. So we then asked, in order to capture these changes, we asked, well, where do you normally sleep? And we found that respondents usually lived in a range of locations. 33% lived on the pavement or in squatters, whilst 67% lived in slums. And we did oversample slum dwellers. That's probably not reflective of our service users, but again, it's probably around access to mobile phones. Service users typically lived in close proximity to the drop-in centres, and this really largely reflects the nature of the program. And the word cloud illustrates the many different locations that people lived in throughout Dhaka and Chittagong, and the size of the word is proportional to the number of participants from that area. So we then asked, well, where are you currently living and sleeping? Surprisingly, our study found that 98% of people that we called had stayed in the city. And this is somewhat different to the narratives that we're seeing around the urban poor migrating at the moment to rural areas. We also captured, if people had shifted from their usual sleeping and living location. And we did find that some people had moved. We had 18% of people who had shifted during lockdown. And this was often due to slum and pavement evictions. Some people had banded together and got houses during this time in an attempt to prevent getting infected by COVID, whilst others were squatting in abandoned buildings or infrastructure in an attempt to save money from rent. So when we asked, well, what are you going to do post-lockdown? 98% of people planned to stay in their city. Reasons provided including having nowhere else to go, better earning opportunities in the city, and an inability to stay in their village, often due to social, economic, or land-related causes. This largely reflects, the drivers of homelessness that we know. So then, we, like many other surveys in this space, really wanted to know about changes in employment and income as one of the key issues that we're really seeing at the moment. And unsurprisingly, we saw that 88% of people reported that they were not currently earning. And this dramatically contrasted to that before lockdown, people were earning 87% of participants earned more than 100 tucker a day. And for international viewers, that's about $1.20 USD. Importantly, men were more likely to report that they were working than women. And we saw that we asked occupation before lockdown and after as well. And we saw that one of the most resilient occupations was street vending and hawking, which is slightly more socially acceptable for men to engage in. And we saw that many women had lost their garment factory jobs, and only some had been able to retain their domestic worker roles. And so this dramatic loss in income and employment has naturally impacted food security. So we asked how many meals people would generally have on an average day before or after lockdown. And we saw a pretty big shift in food consumption. Before lockdown, 73% of participants ate 3 or more meals a day. Whilst during lockdown in the last 2 weeks, we asked, 94% of participants were skipping meals. So in order to explore food security a little bit more, we asked people, well, how confident are you in eating at least 1 meal tomorrow? Can we go to the next slide, please? And this revealed a really high degree of uncertainty. Overall, over half of people, so 56%, were only somewhat confident that they would get 1 meal tomorrow, whilst 14% didn't believe that they would have a full meal. We then analysed those results by living location, and we found, kind of surprisingly, for me at least, that squatter and pavement dwellers were more likely to be confident of having 1 meal a day than slum dwellers. And I was kind of a little bit surprised by that. We typically see this group as experiencing higher economic and social precarity. But this finding was backed up by our staff FGGs, and it revealed that slum dwellers were finding it more difficult to access food distributions during this time. And this was due to geographical distance, police barring people from leaving slums or making it difficult to walk the streets. And this meant that pavement and squatter dwellers were much more mobile and able to access distributions during this time. So that brings us to food distributions. I think we need to go back in the slides, please. Perfect. So food distributions have been a really important but challenging issue during lockdown, particularly for the urban poor to navigate. And we've seen that these are important for people who don't have savings, but also challenging for the homeless who may find it difficult to store or cook food. So we found that 86% of respondents had received a food package. And I will just note here that this high percentage is probably not generalizable to the general urban poor population, purely because these respondents are particularly well linked into the Arnhem service. And we'd done food distribution only a few weeks before. However, only 49% had received between 1 to 5 kilos of rice. And this wasn't enough for people for their, on average, 6-person households. And this meant that people had begun to skip meals, as we've seen, borrowing money and risking violence and COVID that we'll talk about later in order to access employment and food. We also saw, staff really wanted to talk about food distributions. And particularly, the challenges we'd faced, but particularly also the challenges that people were facing in accessing food from ward counsellors. And being put on a list was not necessarily a guarantee that you were going to get a package. There was a number of reasons behind this. Again, movement restrictions. We found that people, if you weren't registered to vote in that particular ward, sometimes it was difficult to get access to a package. And people may found that, even if they turned up early on the day that they'd understood a distribution to be on, they were told that they were finished when they arrived. So moving on, we moved from income, employment, food security to asking about health and water and sanitation. So we found that most people have soap and water and are frequently washing their hands in response to public health communication, which was encouraging. But a key and unexpected finding was that people are paying a lot more for water. Costs have at least doubled during this period for many people. And this meant that some people were borrowing money to pay for water. And this was a real concern for people, many of whom were putting it on their tab, in slums at least, for their end of month payment. And many people were saying they had absolutely no idea how they were going to pay, but that they knew that they needed to be washing their hands, and they were trying their best to do that. We are seeing a seemingly low incidence of poor health, and we also attempted to understand the connection that our respondents had to people who may have died from COVID-related symptoms. And this is encouraging, but we should also note that this was back between the 19th to the 26th of April, when also official figures of COVID were quite low. And we're going to be using these figures as a baseline for future rounds of the survey. We did have staff, though, say that they suspected that potentially people were underreporting ill health and deaths, potentially because of the stigma surrounding COVID that we're seeing documented in other research. But our participants were also discussing this stigma themselves as staff. And so this brings me to people's worries that they were discussing in the survey. Not unsurprisingly, we see that food and unemployment were two leading concerns for people. The third, reported very closely behind unemployment, was contracting COVID, reported by 91%. Staff, FGDs discussed this in some length. They talked about people's fears of being labelled as having the virus, people's real concerns about not knowing what was going to happen to them, where they could get access to healthcare, very confused about what the treatment was, as well as the economic and social ramifications of what would happen to themselves and their families if they did indeed contract COVID. They were talking about men in the family going out, spending time in char stalls because they were unemployed, watching the news that was filled with international headlines around COVID, seeing the scenes of Italy and the US unfold, and becoming incredibly worried about, well, if that's happening there, what's going to happen here in Bangladesh? And people, were very worried. They were very aware that being in a densely populated slum was something that was going to increase their risk of contracting COVID. There was also the very, we're also seeing in the worries that people were discussing that the very real threat of people becoming evicted and going back onto the streets because they couldn't pay rent or the bills and their debt. And some people had very understanding landlords and other people were really afraid of what was going to happen at the end of the month. And the staff really painted a very acutely precarious economic situation that families were finding themselves in. So we then asked about violence. We already know that this population experiences routine, everyday violence and harassment from a number of different perpetrators. But even so, we saw that 55% of respondents reported an increase in violence since lockdown. We should note that the people, there was a percentage, about 10% did note a decrease in violence. And this was typically people who weren't leaving the house, so adolescents, older members of the family. And so they were somewhat protected. If someone said, yes, we have experienced an increase in violence, we then asked them, well, who is the perpetrator of this increased violence? Not all of your violence, but the aspects of violence that have increased. And multiple responses were allowed. So 70% of people cited the police. Police violence is a key ongoing concern for this population, particularly pavement and squatter dwellers. But it's also expanded into underdeveloped slum dwellers during this time. And this has largely been in response to people attempting to leave slums, examples of the police beating people when they're attempting to engage in livelihoods, particularly rickshaw dwellers or street walkers who are trying to earn after 2 p.m. But there was also some encouraging stories where staff were saying, that there are some good police. Police are trying to explain to people why they can't go outdoors. They're trying to tell them about corona. And yeah, so there's also some good stories there. Survey findings also suggest, like other studies, that family violence is increasing. 51% of participants said the perpetrator of increased violence was their spouse, and another 29% discussed other family members. We also had this really interesting thing that happened in our pilot. On our first pilot, one of the staff members asked us to include health and coronavirus related harassment in our lists of what type of violence have you experienced in the last 2 weeks. And I was like, oh, okay, sure, let's do that. And we found that 26 of participants reported coronavirus physical or verbal harassment. And it's kind of interesting. In some ways, it may somewhat confirm the stigma surrounding the virus, as well as potentially also reflecting the normative public assumption that this group of people are dirty, they're vectors of disease, as is documented in other research, this perception of this group. But I'd also really like to note here that this is not that backed up. This perception isn't backed up by the data that we're seeing in this survey, particularly around people's priorities around hand washing and also their food, their health status. So one of the last things that we asked, we're almost to the end now, was around their access to mobile banking. And this is really in response to the potential of the government pursuing cash transfers via mobile banking methods. And that's received some attention, particularly in the last few weeks. We found that 63% of people, of our participants, didn't have immediate access to mobile banking, so they didn't have it downloaded or they didn't know someone who did. But unsurprisingly, access to mobile banking was lower amongst those who lived in pavement squatter dwellings as opposed to people who lived in slums. Sorry, unsurprisingly, I'm not sure if I said that. But like we're seeing in other studies and accounts from BRAC, that people are willing and ready to obtain mobile banking services. And one staff told a story about someone who had called her up like just a few hours later and said, Appa, I've downloaded the app. I have access now. And wait, I'm not sure if it was the app. She registered for an account. Sorry, I'm going off on a little tangent there. But she had got herself access to an account, and staff were saying, well, maybe this is a feasible way of doing cash transfers. And I will note that yes, these findings are really encouraging. It's great to see that people are so responsive. But we do need to be mindful of access to technology, digital illiteracy, as well as disproportionately higher rates of illiteracy amongst this particular population, which needs to be considered in any widespread targeting and distribution methods. So in summary, Amra Manoj service users are a highly unique and very diverse population, as is represented by the challenges and opportunities posed by their living locations. It's important to note that this is an under-researched and difficult to engage with population, and this survey provides important insights into the realities on the ground during lockdown. This is a group who hasn't left their cities, despite the media narratives surrounding the migration patterns of the urban poor, often because they have no place else to go, or the city represents the best option that they have to them. For many, the city is their home, despite some not having access to housing. And this is a group that's already economically, socially and spatially marginalized, as is illustrated by the high rates of violence, food insecurity, fear and stigma that this population faces on a daily basis and has now only increased since lockdown. But we do also see that this population is highly resilient, are utilizing a wide range of strategies to try and cope and adapt to the challenges posed by them, to try and change, we saw people shifting livelihoods, trying to decrease expenditure and specifically adapt to the situation. I would be remiss not to mention that the staff in our FGDs, when we asked about their recommendations, they went to great lengths to explain exactly why food distributions alone were not enough. People needed money, and often urgently, to prevent hunger, loss of access to water, and to prevent evictions, and people being back on the streets. And we're seeing that widespread and collective efforts are really urgently needed in this space. And it's not just immediate needs that we need to be thinking about. I really hope that this research allows all of us working in the urban space an opportunity to discuss the enduring structural inequalities faced by this population and their longer term needs, adequate housing, access to wash and health services, sustainable livelihoods, and social safety nets. And I really firmly believe that we all need to be thinking about ways of collaborating, working together to develop targeted, coordinated mechanisms to reach and work with the urban poor in their cities. Thank you so much.
Sorry, I'm on mute. Thank you very much. I think that was really comprehensive. I will come back later, but I think a number of findings that you that you presented are actually very aligned with a much larger survey that BIGD and PPRC just conducted. So I think we'll have an opportunity to sort of talk about some of those areas of alignment and how your work actually takes some of the issues further and what some of the kind of next questions are. But at this stage, I would like to invite our two discussants. Firstly, I'd like to invite Dr. Sajida Amin. She leads the Population Council's work on livelihoods for adolescent girls, at least as far as the Google blurb tells me. But she is a sociologist and a demographer and works on essentially evidence on empowerment program for girls and women. I think that's what she's really, her work focuses on, and she's also does a lot of work on opportunities in girls and women's lives. So I'd like to now ask Sajida to give her thoughts, but let's try and finish it within 5 minutes, Sajida. Thank you.
Thank you. That was excellent presentation, and there are a number of things that I really liked about this study, and I'd like to highlight in my comments. First, to kind of speak to the question that often comes up in the context of doing these rapid surveys and phone surveys is about how representative it is. Next, I want to talk about the population and what this really adds to most representative survey responses. And then I want to say a little bit, even though I want primarily to focus on research takeaways, I want to say a little bit about what I think programmatic responses might be for this population. So my first reaction to the question of how representative is the survey, the easy answer is that we reached 72% of who we tried to reach. But that's really the wrong question. The question is, who does it represent and whose realities are you reflecting? So as Imran said in the opening, you're really focused on a very marginal, very vulnerable group whose experiences are not reflected. And so I liked how Shoshana put it in her little thought bubble that on the methodology, that we have to be mindful of who doesn't have a phone or who doesn't have a functioning phone, and the fact that under lockdown, the reason you don't have a functioning phone is because you can't charge it. So these are kind of the ground realities that we need to be thinking of. I think that part of the explanation of why the results of this survey are very believable, if you accept that it is legitimate to have a survey that focuses on the specific characteristics of this group, is A, because of the response rate, who picked up the phone, but then equally, and probably the more important relevance is, goes beyond the fact that I'm talking about a rapid phone survey and what you can get out of it, which has to do with who is interviewing. So I know that right from the beginning, Shoshana was very insistent that the interviews be conducted by Amra-Manav's staff, despite sort of whatever biases that might bring in terms of the staff wanting to show their work in their best light, which would be our concern. So in other surveys that we've done, we've basically, when we've used program staff, we have said they're calling others. They shouldn't be calling people who are they directly responsible for, but people in another community. And so that sort of partially addresses the whole potential for misreporting and bias. But that basic level of trust relationships being a platform on which you do these surveys is really important. Both in terms of, and in this case, it's using staff to ask survey questions, etc. But in other situations, it might be like interviewing like. So definitely not having a man call a woman or a woman call a man, but also somehow signaling that it's someone who understands you and understands your reality and speaks your language, of course. But that basic trust, I think, is, to the extent possible, something that we should be focusing on in rapid surveys. And then I want to come to my final observation that I want to make, that is less about doing a survey and more about what to do about it, which is related to this issue of trust, which is how, in this time of rapid surveys, remote surveys, phone contacts, phone disbursements of money, I think we have to get very creative and very articulate about how we are getting creative is, how do you establish those trust networks? In Amrao Manush, you have a network of staff who have been in direct contact, very intensive interactions. I know that there are many other urban slum populations that have taken alternative approaches, a bit like the drop-in center approach, but BLAST has a program among the urban where they also have this create a space, a safe space for young women in particular to meet. And we need to figure out, I work a lot on programs that are also about providing safe spaces for vulnerable groups to get together in. And we need to figure out how to sustain and replicate that. And it relates back to this question that we've been hearing Shahiduzzaman talk about a lot, which is, what is a community? What is the space in which you have mobility? What is home? All of these, I think, should be very creatively interpreted in this context where we are talking about social distancing, stigma around social distancing, which are as real phenomena for everywhere, and much more so for the most vulnerable, because they're out there, they're unprotected in so many ways. So I'll end there. I think I'm up with my 5 minutes.
Yeah, you are. I think that was really, really helpful, because I think this, and this is something that I think the kind of conversations we want to promote in this webinar platform of Coronai Oikko is not to dumb down on the research conversation and the program implication conversation. We want to have substantive discussion around the rigor and the reliability and the methods innovation of the research side as well, because I think we don't need to dumb down on that just because, it's a time of crisis. And as a matter of fact, precisely because it's a time of crisis, we need to step up and we need to be far more innovative on the whole rigor and reliability front, so that we can actually create evidence and knowledge that can be more useful. So that's the spirit that I really want to ensure that in this platform we try and nourish. Great. I would now like to invite our other discussant, and we heard from Sajida more as a researcher, from a research perspective primarily. But from AKM Musha, Dr. Musha, we're going to be really focusing on programmatic perspective. Now, let me just introduce him. He actually is just an in between kind of a place right now. I mean, he just finished. He was the country director of Concern Worldwide Bangladesh, and he's moving to be becoming the country director of for Concern in Republic of Sudan. His career has been, I think, as I can see, it's primarily with Concern Worldwide, and Concern is one international NGO I think we all have a deep respect for, in terms of its real focus on the most marginal, and really trying to focus on the most deprived and the most marginal, in different kind of contexts. So. I think he would really bring in extremely valuable perspective here. Dr. Musha, over to you.
Thank you, Dr. Imran Mothin. since I'm to focus on the programmatic responses, but I'll be talking from the perspective or insight that I have the opportunity to lead the design of this urban Manush program and have long experience of working with these homeless people and people living in these quarter settlements and undeveloped slums. So bringing some field perspective and offering some insight from that.
Dr. Musa,
So,
could you somehow reposition yourself to get a bit more better sound quality?
okay, let me try. Is it okay? Okay, so what we understand that this is a very, very difficult time. It's a kind of a situation-defined moment, a defining moment that has offered an extraordinary challenge and an uncertainty and ambiguity. So based on different scenarios, what I see that this challenge is not going to go away in next 2 to 3 years at least. Even the scientists are is successful in bringing the vaccine and the medicine, because it need herd immunity to ensure the if we can cohabit with this virus, like we are cohabiting with influenza virus now. So what the study with this study is telling us about the most vulnerable people. We see this is one of these homeless people, these people who are living in quarter settlement and developed slum. They're one of the most vulnerable groups in this country. And their major concern, as I see, is the food insecurity and hunger, unemployment, and co-infection, COVID infection. All three are, I see, interlinked. Actually, COVID, created the unemployment due to shutdown, and that has resulted in a humanitarian crisis and food insecurity. So it's all underlinked. And this unemployment obviously will further increase other vulnerabilities. Like, this group of people, at one point, they will be evicted from their current places due to inability to pay rent, as they don't have any income. And also there are other social problems they're already experiencing. Now, question is, how do we address this health and economic crisis? This I see as a health and economic crisis resulting into humanitarian crisis. And not only in Bangladesh, there are many other countries. So we need to look at this response. When you look at response, based on my own experience, although it is not covered in the study, we need to consider 3 other factors which are bringing vulnerability or increasing the vulnerability of this group. One is, if we look at the urban areas, there is no social safety net programs run by the government, except the OMS in some places. But if you see in the rural areas, there is at least some form of social safety net programs, and I think with all the weaknesses, its support is there. If you look at the health, because this is a health risk and health crisis, if you look at the health situation in urban areas, so primary health care system is not developed in urban areas because Ministry of Health is not responsible for this, and Ministry of Local Government and city corporation and municipalities are responsible to provide primary health care service, which they are not well equipped to deliver it. And for the secondary and tertiary hospitals and health facilities, those are run by Ministry of Health and private sector. And many different studies are showing that urban extreme poor people have least access to these health facilities due to different regions. One is, cost of treatment, transportation cost, discrimination, and not respect to health. So there are a lot of different forms of discrimination, while rural population are getting the health facilities, at least at the doorsteps through the CCs and different facilities. At least they have some access compared to urban population. And third area is when In the urban area, although city corporation or municipalities are responsible for all the services, but there are other government departments and ministries are responsible for many different stuff. And there is no coordination. It's very limited coordination between city corporation and government ministries and departments to handle this type of crisis in the urban area. While in the rural area, you will see that certain level of coordination and mechanism established. So, considering all these analyses and the problems and the challenges that faced by this extreme vulnerable people in the urban cities, what is our option? So what I see, since this situation may not really go away very soon, we need to think very, very carefully what we are offering, what we are doing. I see a major three major intervention or a strategy that needs to be put in place, obviously with other smaller interventions, and also there are other interventions that also need to come in play. One is the health response. Broadly, I'm trying to cover is the health response. That should have two more broad components. One is the support for this group for their preventive practices. That includes, wash, water, sanitation, and all others, and also the curative, care to support them to access the health facilities, to get the services when they are required to go there. So that may require offering support for transportation, some cost, or whatever support is required. So this health response is very important, because ultimately, gradually, although when the infection rate will high, this group will be more vulnerable because of the congested and condition they are living in. And also, we need to handle this humanitarian crisis, food crisis, and other basic necessities, what they are telling. And the study and the group recommended the food or cash transfer, that either way we can use, but different studies and experience of NGOs in different countries and different situations, it shows that cash transfer is better option, because the market is functioning, the supply of the food and basic necessities are functioning. So this is the moment where we need to go for cash transfer. So we may need to continue this for a quite long time, because if even the economy opens up, there will be partial opening. It will not be going back to the normal. So this mechanism needs to put in place until such time where we can really live with the virus without experiencing a big health risk. And now the longer term options, since the economy will be, if the economy opens, but still probably the economy will not be in a full functional situation because of the health risk. That risk will continue. So I don't see that economy will be in full functional. Even market is open and even businesses are open, it will not be fully functional. We see in China. So what will happen then if it continues for a long time? Many of the businesses actually will not really be able to exist. On the other hand, there will be new businesses will be emerging, like we already see there are new businesses are emerging. So what does this mean to this group of people for their employment? If shutdown is relaxed or open, then they need to go back to the work. So if they go back to the work, there will be support required for them to facilitate that process, to reduce the risk if they go to their previous employment, if they can. So we need to support them to reduce that risk, but from the employer's level and from the also state or other support mechanism should offer that support.
Okay, thank you,
And then, yes, I'm finishing up just that point. And then, if the new business, we need to develop the skill. And then many of the people who used to do the petty business, from my experience, I see they will require support to start the business or restart the new business. They will need capital. The question is, who is going to do that? We need to have that. Government is not ready to roll out the social safety net program in urban areas. because there are a number of factors they consider. So I see the NGOs and civil society should come together with support from, obviously, collaboration with government and support from donors, private sector, and public. So win-win. We should join hands to handle this situation. So, and then eventually government should take over. So that's my some of the thinking about the programs and implication of the current situation on this group of people. Thank you very much.
Thank you. Thank you very much, Dr. Mohsen. I think you laid out the complex systems challenge that we are in, and I think, you know, this is like a very complex maze that every wrong step reconfigures the system. So you need to basically then, you know, kind of it becomes even a more complex problem. And I think you rightly pointed out that the heart of this is the health response strategy. Unless we have the right type of health response strategy, you know, we're just not going to be able to relax any of the sort of lockdown. At the heart of smart lockdown is actually an appropriate health response strategy. And I think you are absolutely right in pointing that out. And the urban context, this is particularly challenging because of the way our health system is structured. And you know, thank you very much for that. And hopefully, you know, we can get some questions on that. So I just wanted to now move to some question and answer that I can see here. Just to let you know that I thought that we could finish this in an hour. We finished about, so it's almost getting to an hour. But I think this is really a rich conversation that's already happening. I think the two discussants, you know, raised a number of very interesting points. So I think we'll continue at least until 9:15, and then we'll conclude at 9:15. So just looking at some of the questions that we basically have here. So there's a question to Shoshana. It says that the survey report shows less than 2% move to the rural areas. On the contrary, online and broadcast media reports show high numbers returnees. How could we validate and compare between different reports, so on, so forth. So do you have any response to that? If you could just write that down, you can get to that later. I have something to say on that as well, based on some of the work that we have been doing. Then there's a question on what did those few participants do when they came to know that they probably came in contact to some suspected COVID-19 patient. I don't know whether you've got anything to say on that, but if you don't say,
we didn't specifically ask about that.
We don't really know that. So did you also take into account the issue of floating sex workers and IDU and other kind of drug users? Again, that could be yes, no answer.
We didn't specifically ask about people's risk-taking behaviors.
Right. As far as I know, there is a separate study that the James P. Grant School of Public Health did on sex workers, I think. So, you know, and I think it's available on their website. We'll also make it available on the Corona Oiko website as well. And, you know, I think that could be a good source for you to understand that, what's happening on that side. But clearly that's important, very important group. Could you elaborate on adaptation strategies? I don't quite fully understand what adaptation strategies is, but perhaps Shoshana, you know. So could you respond to those questions?
Sure, absolutely. So let's start with the adaptation strategies. I actually had a whole slide on that, and I ended up taking it out just for time. But really, you know, we asked a number of questions that weren't presented in the presentation, purely because of time. But we did ask, you know, what was your occupation before and after lockdown? We saw people shifted occupations. A lot of people had shifted, you know, from being a CNG driver to a rickshawala. We saw people shifting a lot to street hawking. Some people turned to begging sometimes for the first time. And so strategies that were, you know, a little bit more likely to earn them some money. We saw that people were eating a little bit less, you know, skipping meals, but particularly women. And in response to violence, they thought that was a strategy to reduce the violence that they were experiencing. Women had started to bring food home if they were housemates, and families had been quite generous in giving a little bit more food. And that was actually another really interesting, something that I wanted to mention is we asked it about where the source of your food was. And we were seeing a lot of people. We didn't specifically have a category for this, so we collapsed it. But in another round, I'd like to have it as a separate category as, you know, just normal people in people's neighborhoods that have come out and given food packages or cooked food to people in response. And there was this incredible generosity, but, you know, it was quite ad hoc and not coordinated at all. People are really drawing on their social networks to survive. This includes, you know, your landlord, your friends, but we do know that this is a highly socially marginalized group and people don't often have good access to social networks. And so this means that people, some people are really disadvantaged during that time from that particular strategy. And I think I spoke to a couple of others, you know, people moving into slums, people moving out of slums, into abandoned buildings, people moving into the pipes on the poor, yeah, a bunch of different strategies.
Great, and on the low incidence of
right.
Yeah.
Yeah, I mean, it is a very specific population, right? And I think this, you know, one way that we can probably verify that is to think about, well, why are people homeless in the first place, right? And if we look at studies around that, the responses around why, what's your plan after lockdown and why? You know, people were speaking to, well, why are we going to stay in the city? And those findings really resonate very strongly with the reasons why people experience homelessness in the first place, why they'd often migrated from a rural area to the city in the first place.
Great, thank you. Just on the point about this low, I think you responded it very well. I think, you know, one way to think about any figure is always to unpack the figure and basically say, okay, why do we expect this to be higher or lower? You know, what are the dynamics? What are the mechanisms? And, you know, how do these mechanisms would behave in this particular context, right? I mean, in the early days, and this survey was done in initial period, in early days, I think there's still a lot of uncertainty. So I think maybe in the later time period, you know, people may behave differently. But in the survey that we did, and this is again the survey that PPRC-BIGD, we did a survey of 3,000 urban slum dwellers and about 3,000 rural households. So it was very large and nationally representative. We find that 6%, so only 6% of the urban slum dwellers moved from, and this was an early time, from 8th of April until the 16th of April. That was the 14th of April. That's the time period we did our survey. This is a very similar time period, a bit of overlap, I think, from yours. Yours is just slightly later. Now, there's sort of two things. So one is, I think there's correspondence. You know, I mean, people don't want to move their livelihood. They don't, if you're uncertain about what support you're going to get, you want to hang on to your whatever meager livelihood opportunities you basically have there. You want to test it out before you sort of make that type of a drastic decision. And what we find slightly that, and it's not particularly large difference, but slightly more, the likelihood of slightly better off people among the urban slum dwellers to migrate is slightly higher compared to the poorer people. And that's what one would expect. And in your case, because you are actually dealing with the really bottom of the pyramid here, the most vulnerable, you actually find even a lower incidence of urban to rural migration. So I think there's actually sort of ties together. I think it makes sense. However, from a health point of view, you can imagine 4 to 6% of people within a short time period moving. From a health point of view, this is huge. This is still huge. So, you know, we should not, kind of undermine the health dimension of this. You know, within such a short time period, so many people moving out, general holiday declared, that reality remains, irrespective of the fact that it's only 4 to 6%. Right? So I think it's just how we sort of think about it, right? And I think there are other implications of this 4 to 6% in terms of program design and response that we basically want to do. Great. I think there was another question. And let me just see that. I think it was a very interesting question. Yes. Is the COVID-19 related harassments is 26%, 24%. Maybe you want to elaborate on that a bit more. And then I think there are a few other questions I'll take. Shoshana,
Sure. I mean, it seemed like it took many dimensions. It seemed, we didn't specifically tie particular types of harassment to perpetrators. But staff FGDs did talk very little bit about this. It was mainly public. It was people saying things. It was mainly verbal harassment.
Okay. So this is
calling people names.
Primarily stigma, the things
Yeah,
that.
absolutely.
Okay. There is one question here. There's a hand raising option. So in case, I don't want to get overwhelmed with hand raising, don't have that much time, but in case some people want to hand raise, I can call them in. I can see somebody, Rafiqul Islam, you wanted to come in, but there's one question before I bring you in. And this question is, it's really about, was this study only based on Sajida Foundation intervention population? And the point is that the picture would be different, or perhaps maybe different, if it were general population outside the intervention area. Any thoughts on that? I don't know, you or maybe even Sajida, you want to say something about that?
Yeah, I mean, I'll just briefly say that yes, it was only service users of this particular service that was provided. And yes, I think some findings may not necessarily be generalizable, particularly around things like food distributions, because we targeted service users who were tied in with us, as well as other. We've expanded food distribution since then. But so Sajida, would you like to expand on that?
Yeah, I'll ask Sajida, but does that really mean that this may actually, I mean, in terms of the general population of this segment, is situation even worse because here you have got at least some intervention? Is this like an upper bound?
I would, we don't have data to that. So as a researcher, I can't say, yes. But as someone who has is in contact with people who live in Komlapur station, yes. As an observer, yes.
Sajida?
I don't know that I have much more to add, but I loved Shoshana's name cloud of where these slums were, and I think it tells you that it's not Korail. And I think at least that's one big cluster that is probably better off than this cluster because it is a slum. And I think this is sort of speaks to the specific nature of urbanization and urban poverty in Bangladesh that is very difficult to address, which is that we have a very dispersed geospatial pattern to the locations of where the urban poor are. And when we've tried to do programs, we all gravitate towards the Korails or the well-known big bastis because they are identifiable. They're large and they're easier to work in.
Thanks.
Can I please just add one thing? Sorry. I will just say that, a lot of people don't have access. The more vulnerable subset of this particular population, particularly the homeless, don't have access to a mobile phone. Or people that I know who do normally answer their phones aren't answering their phones right now because they don't have access, like Sajida was saying, to the shop owner who lets them charge their mobile phone at the moment. So there's no way of getting in contact with them, and I would say that this the people that I know who I'm not able to get in contact with, they are more vulnerable.
Exactly, and Shoshana, when you use the word charge, you mean flexi-load. You don't mean
electrical.
Oh,
electrical, but potentially also money as well. Flexi-load, yeah. But I'm talking about so that the number isn't even ringing. So we're assuming that they, it's not charged at all.
Mr. Rafiqul Islam, you wanted to come in, please? We can't hear you. And I asked Imtiaz, could we get Mr. Rafiqul Islam in? No?
Is it?
Yes. Yes.
No, okay.
Yes, we can hear you now.
Yeah, thank you very much. Thank you. Very, 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 very intensive and very clear and very focused survey it is. Thank you. Even the presentation, Dr. Susanna Williams, and the Sajid Amin, and Cam Musa also. Thank you so much. I have the two concerns. One is, as the survey is done in mid-April or something, so now is late May, situation has changed. And the one thing it is very noticed in that the COVID cases in the slum areas still very insignificant. If the situation changes because the social distances, physical distances, securities, as Dr. Musa mentioned, and the other things, additional extreme poor people migrated, added extreme poor after the COVID effect in the rural area. Islam again.
Mr. Islam, we could not catch you. We could not catch you.
The situation will be.
We could not really hear you for the
how.
Yeah. If you could just ask your question, that will be great.
So do you have the go for second phase survey to see the changes?
Okay. Thank you very much. Shoshana, any repeat survey plans?
Yes, is the short answer there.
Right.
Exactly when? Probably in the next couple of weeks.
Fantastic. We really look forward to that. And also to just to let you know that the survey that PPRC and BIGD did, the 6,000 household survey, we're also going for a repeat survey just after Eid. And we are hoping that by mid-June, we'll be able to share results. And, we're going to address some of the, some new dimensions that in that survey, because obviously there are new things that we need to look at right now. Great. There's a question here. I don't know whether we have an answer, but I'm going to anyway read the question. It's the workers are falling sick since they live in dorms, they infect others. Many such COVID-19 patients should be housed in fully staffed quarantine facilities. Where are they? Where are these fully staffed facilities? I don't know whether any one of you have an answer. Dr. Musha, do you have any thoughts on that? We can't hear you, Dr. Musha. You're on mute.
I did not see the question,
Okay, I'm telling you the question. So the question is basically it's about dorm facilities of urban workers. Right? So, that many such COVID-19 patients should be housed in fully staffed quarantine facilities. So where are these quarantine facilities? That's the question. Now, I don't know whether you've got any thoughts, any answers to that.
There are different government facilities, isolation, they're calling it isolation centers.
Right.
And mostly it is encouraged that people will be, quarantined at home. But within the, urban setting, particularly in the slum setting and the group of people we are talking about, it would be extremely difficult. So government was planning to set up, different places. There was initial some resistance from the localities, some areas. People did not really want to get those isolation centers and the quarantine centers in those areas. But obviously, government is setting up some of the things, and there are information available. So you can look at the Ministry of Health websites and the ABCR websites. So you can get those.
Okay, all right, great. Thank you very much. I think we have had an excellent, set of questions, and I think, good conversation. So thank you all very much. I just have a few reflections from my side. I think the first reflection, is that, and I think this is coming out extremely clearly also in the PPRC BIGD survey that we did, is that the crisis, there is a big urban-rural divide of this crisis. It is the urban area that is actually, most affected, not only in terms of the infection, but also in terms of the overall economic crisis and the economic fallout. The urban resilience is lower. you know, the reliance on the market is much higher. And I think there's no social protection mechanisms, or our systems, either in social protection system or a health system, are just have never really considered the urban poor as valid inhabitants in the urban space. And I think that is coming across so powerfully across the different studies. And I think this should be one really strong action agenda that I think we should, you know, as researchers and you know, people working on the intervention side should really coalesce around and really you know, kind of take this forward and come up with ideas in terms of what should be done in the urban context, both on the health and on the hunger side. So I think this is one key area for me and key focus area. A few others, I mean, I just also mentioned, I think there's a lot of alignment between this study, this survey, and the survey that that the PPRC and BIGD did. I talked about mobility. There's also a huge correspondence in terms of the effect we see on work and on consumption insecurity. I think that's extremely, you know, kind of, I think, aligned. Very interestingly, on the concern side, you know, again, very aligned. I mean, this whole debate about health versus life versus livelihood is just not what it is for poor people. You know, they absolutely understand and they fear the COVID crisis, but they also need to be fed. So I think this whole distinction, and that's really not a very helpful way of thinking about this complex systems crisis that we are in. It really requires a health and economics partnership, and thinking about that in a very synergistic way, in a systems oriented way. And I think the two, and this is my final point that I'll make, is that I think the big strategic opportunity that we may have here is to really come up with a social protection system and a health system that actually serves the majority, that actually works, that is not fragmented. And I think we are seeing that both our social protection system and our health system are totally fragmented and broken. And I think here's an opportunity. This is a crisis period, so we have to work on war footing. So we cannot only rely on, you know, our existing, you know, kind of governance system to actually, you know, kind of deliver, but we need to work with that, and we need to think out of the box, but we need to mainstream those innovations so that ultimately in the longer haul, we actually get a fit for future, fit for purpose system in our social protection and on the health side, because these two are the critical pillars of any decent society. And so I think there's a strategic opportunity here, you know, and I think we should keep on pushing on that. With that, I'd like to thank everyone to you know, who sort of joined, and we'll continue this conversation. There'll be more webinars that Corona Oikko, Unity in Corona webinar series that we will be bringing you more exciting research that's basically happening at this time. With that, thank you all very much.
হ্যালো, যোজন ভাই আছেন?
জি, ইমতিয়াজ ভাই।
হ্যাঁ, আচ্ছা ভাইয়া, তাহলে আমাদের তো ওয়েবিনার শেষ। এটা হচ্ছে আমাদের একটা ক্লাউড রেকর্ডিং হয় অটো, সো এটা প্রিপেয়ার হয়ে গেলে আমি হচ্ছে আপনাদের সাথে শেয়ার করব।
জি, শিওর। আপনি মেইলে দিয়ে দিবেন, রাইট?
এটা মেইলে শেয়ার করব।
আচ্ছা, ঠিক আছে। থ্যাংক ইউ ইমতিয়াজ ভাই। হ্যাঁ, থ্যাংক ইউ ইমতিয়াজ ভাই। বিধান ভাই যদি থাকেন, থ্যাংক ইউ সো মাচ।
ওকে, সো আমরা
জি, তাহলে আমি লিভ করছি। ওকে।
Thank you everyone for joining.